100 questions and answers for the doctor's competency exam. Topic: ear, nose and throat, head and neck, ENT-HN. 1. A child presents with otalgia, fever, and otorrhea after an upper respiratory tract infection. What is the most likely diagnosis? Answer: acute perforated otitis media. 2. What is the most common complication of chronic otitis media? Answer: Cholesteatoma. 3. An adult patient with recurrent vertigo, tinnitus, and sensorineural hearing loss. What is the diagnosis? Answer: Ménière's disease. 4. What is the main diagnostic examination for otosclerosis? Answer: pure tone audiometry. 5. A child presents with a feeling of fullness in the ear and hearing loss after an upper respiratory tract infection. Diagnosis? Answer: otitis media with effusion. 6. A patient with conductive hearing loss and tympanic membrane perforation. What is the definitive treatment? Answer: tympanoplasty. 7. What is the most common cause of diffuse otitis externa? Answer: bacterial infection, Pseudomonas aeruginosa. 8. A patient presents with facial nerve paralysis due to an ear infection. What is the diagnosis? Answer: chronic otitis media with mastoiditis. 9. A patient experiences a ringing sensation in the ear without an external source. What is this condition called? Answer: tinnitus. 10. What is the primary cause of sudden sensorineural hearing loss? Answer: idiopathic, often related to vascular or viral factors. 11. A patient presents with unilateral nasal obstruction, purulent discharge, and anosmia. What is the most likely diagnosis? Answer: acute rhinosinusitis. 12. What is the most common cause of epistaxis in children? Answer: digital trauma, nose picking. 13. Where is the most common site of anterior epistaxis? Answer: Kieselbach's plexus. 14. What is the primary cause of posterior epistaxis? Answer: rupture of the sphenopalatine artery. 15. A patient presents with clear nasal discharge, itching, and recurrent sneezing. Diagnosis? Answer: allergic rhinitis. 16. What is the first-line treatment for allergic rhinitis? Answer: intranasal or oral antihistamines. 17. A patient presents with bilateral nasal polyps and a history of asthma. Diagnosis? Answer: nasal polyposis. 18. What is a characteristic radiographic sign of maxillary sinusitis? Answer: air fluid level. 19. A patient experiences anosmia after head trauma. What is the main mechanism? Answer: damage to the olfactory nerve. 20. A child presents with unilateral nasal obstruction and chronic purulent discharge. What is the most likely diagnosis? Answer: nasal foreign body. 21. A patient with severe sore throat, dysphagia, trismus, and uvula deviation. Diagnosis? Answer: paratonsillar abscess. 22. What is the most common cause of acute tonsillitis in children? Answer: Streptococcus pyogenes infection. 23. A patient with chronic hoarseness, smoking history, and a mass on the vocal cords. What is the most likely diagnosis? Answer: laryngeal carcinoma. 24. What is the primary treatment for a retropharyngeal abscess? Answer: surgical drainage and antibiotics. 25. A patient presents with progressive dysphagia and regurgitation of undigested food. Diagnosis? Answer: Zenker's diverticulum. 26. What is the most common cause of acute laryngitis? Answer: viral infection. 27. A patient presents with sudden throat pain, high fever, and stridor. Diagnosis? Answer: acute epiglottitis. 28. What is the characteristic radiologic sign of acute epiglottitis? Answer: thumbprint sign on lateral neck X-ray. 29. A child presents with inspiratory stridor and a barking cough. Diagnosis? Answer: laryngotracheobronchitis, croup. 30. What is the main cause of chronic hoarseness in non-smokers? Answer: laryngopharyngeal reflux. 31. A patient presents with unilateral parotid gland enlargement, pain, and fever. Diagnosis? Answer: acute parotitis. 32. What is the primary cause of suppurative parotitis? Answer: bacterial infection, Staphylococcus aureus. 33. A patient presents with swelling at the angle of the mandible that worsens during meals. Diagnosis? Answer: sialolithiasis. 34. What is the most common cause of acute cervical lymphadenitis? Answer: upper respiratory tract infection. 35. A patient presents with an anterior neck mass that moves with swallowing. Diagnosis? Answer: thyroglossal duct cyst. 36. A child presents with a lateral neck mass that recurrently becomes infected. Diagnosis? Answer: bronchial cyst. 37. A patient with neck trauma and hoarseness. What injury is likely? Answer: laryngeal injury. 38. What is the most common benign tumor of the parotid gland? Answer: pleomorphic adenoma. 39. A patient presents with dysphagia, hoarseness, and a supraclavicular mass. Most likely diagnosis? Answer: nasopharyngeal carcinoma with neck metastasis. 40. What is the definitive examination for diagnosing nasopharyngeal carcinoma? Answer: nasopharyngeal biopsy. 41. A child presents with inspiratory stridor since birth that worsens when crying. Diagnosis? Answer: laryngomalacia. 42. A patient presents with a slowly enlarging, painless lateral neck mass. Diagnosis? Answer: lymphangioma. 43. What is the primary cause of angioedema without urticaria? Answer: C1 esterase inhibitor deficiency, hereditary angioedema. 44. A patient presents with otalgia, pain while opening the mouth, and swelling in the preauricular area. Diagnosis? Answer: temporomandibular joint dysfunction. 45. What clinical test is used to detect perilymph fistula? Answer: fistula test. Nystagmus induced by pressure on the tragus or ear canal. 46. A patient presents with chronic otalgia with no ear abnormalities. What is the possible cause? Answer: referred pain from teeth, TMJ, or throat. 47. A child presents with chronic otorrhea, tympanic membrane perforation, and hearing loss. Diagnosis? Answer: chronic suppurative otitis media. 48. A patient presents with hematympanum after head trauma. What should be suspected? Answer: basilar skull fracture. 49. A patient with chronic sinusitis develops orbital edema and proptosis. Diagnosis? Answer: orbital cellulitis. 50. What is the main treatment for orbital cellulitis? Answer: intravenous antibiotics and decompression if necessary. 51. A patient presents with nasal speech and mucopurulent nasal discharge. What is the diagnosis? Answer: chronic sinusitis with nasal polyps. 52. What are the indications for surgery in chronic sinusitis? Answer: failure of medical therapy or complications such as abscess or osteomyelitis. 53. A patient presents with maxillary sinus tenderness, purulent nasal discharge, and anosmia. What is the first-line therapy? Answer: oral antibiotics and decongestants. 54. A patient has unilateral foul-smelling nasal discharge. What is the diagnosis? Answer: nasal foreign body. 55. A child develops acute inspiratory stridor after eating a nut. Diagnosis? Answer: airway obstruction by a foreign body. 56. What is the definitive examination for airway foreign body? Answer: bronchoscopy. 57. A patient presents with an ulcerative lesion on the tonsil that hasn't healed for 3 weeks. Diagnosis? Answer: tonsillar carcinoma. 58. What is the main risk factor for oropharyngeal cancer? Answer: human papillomavirus, HPV, infection. 59. A patient develops chronic hoarseness after prolonged intubation. Diagnosis? Answer: laryngeal granuloma. 60. A patient presents with painful cervical lymph node enlargement after a throat infection. Diagnosis? Answer: acute lymphadenitis. 61. A patient presents with a tongue base abscess and difficulty breathing. Diagnosis? Answer: Ludwig's abscess. 62. What is the main treatment for Ludwig's abscess? Answer: antibiotics and immediate drainage. 63. A patient with unilateral tinnitus, hearing loss, and vertigo. What is the most likely diagnosis? Answer: acoustic neuroma. 64. What is the primary diagnostic test for acoustic neuroma? Answer: brain MRI with gadolinium. 65. A patient presents with otalgia exacerbated by tragus movement. Diagnosis? Answer: otitis externa. 66. What is the first-line therapy for otitis externa? Answer: topical antibiotics and steroids. 67. A patient presents with a midline tongue base mass that enlarges during swallowing. Diagnosis? Answer: thyroglossal duct cyst. 68. What is the definitive treatment for a thyroglossal duct cyst? Answer: cystrunk procedure. 69. A patient presents with dysphagia, otalgia, and a tonsillar mass. Diagnosis? Answer: tonsillar carcinoma. 70. A patient with massive epistaxis not controlled with anterior nasal packing. What is the next step? Answer: posterior packing or embolization. 71. A patient presents with recurrent nasal polyps and facial pain. What is the main diagnostic test? Answer: CT scan of the sinuses. 72. A patient develops fever, facial pain, and periorbital swelling after sinusitis. Diagnosis? Answer: cavernous sinus thrombosis. 73. What is the main treatment for cavernous sinus thrombosis? Answer: intravenous antibiotics and anticoagulation. 74. A patient presents with hoarseness after thyroid surgery. Diagnosis? Answer: recurrent laryngeal nerve paralysis. 75. What is the main cause of congenital bronchoesophageal fistula? Answer: embryological malformation. 76. A patient presents with mastoid tenderness and swelling. Diagnosis? Answer: mastoiditis. 77. What is the main treatment for mastoiditis? Answer: intravenous antibiotics and mastoidectomy if necessary. 78. A patient presents with unilateral ear pain, purulent discharge, and fever. Diagnosis? Answer: acute otitis media. 79. What is the main complication of frontal sinusitis? Answer: subdural abscess or brain abscess. 80. A patient with chronic hyposmia without trauma history. What is the likely diagnosis? Answer: nasal polyposis or chronic allergic rhinitis. 81. A patient presents with tinnitus, ear fullness, and fluctuating hearing loss. Diagnosis? Answer: Ménière's disease. 82. What is the first-line treatment for Ménière's disease? Answer: diuretics and a low-salt diet. 83. A child presents with a paratonsillar abscess and trismus. Diagnosis? Answer: paratonsillar abscess. 84. What is the main treatment for a paratonsillar abscess? Answer: abscess drainage and intravenous antibiotics. 85. A patient develops anosmia after a head injury. Likely diagnosis? Answer: olfactory nerve damage. 86. A patient experiences acute ear pain after flying. Diagnosis? Answer: middle ear barotrauma. 87. What is the first step in managing middle ear barotrauma? Answer: nasal decongestants and Valsalva maneuver. 88. A patient presents with a midline neck mass that moves with swallowing. Diagnosis? Answer: thyroglossal duct cyst. 89. A child with acute otitis media develops conductive hearing loss. What is the most likely cause? Answer: middle ear effusion, OME. 90. What is the best diagnostic test for middle ear effusion? Answer: tympanometry. 91. A patient presents with a tongue base mass and cutaneous hemangiomas. Diagnosis? Answer: lingual hemangioma. 92. A patient experiences sudden vertigo and nystagmus that resolves with head stillness. Diagnosis? Answer: benign paroxysmal positional vertigo, BPPV. 93. What is the diagnostic maneuver for BPPV? Answer: Dix-Hallpike maneuver. 94. A patient presents with headache, bloody nasal discharge, and facial erythema after sinusitis. Diagnosis? Answer: mucormycosis. 95. What is the definitive treatment for mucormycosis? Answer: amphotericin B and surgical debridement. 96. A patient presents with a bleeding ear after head trauma. Likely diagnosis? Answer: basilar skull fracture. 97. A patient with chronic inspiratory stridor and hoarseness. Diagnosis? Answer: laryngeal papilloma. 98. What is the main cause of laryngeal papilloma in children? Answer: HPV types 6 and 11. 99. A child with acute otitis media develops fever and mastoid tenderness. Diagnosis? Answer: acute mastoiditis. 100. A patient with nasal trauma develops septal deformity and nasal obstruction. Diagnosis? Answer: septal hematoma.